Well, I think spirometry is recognized as still a good tool to identify the airflow obstruction. The most recent guidelines for treating COPD still talk about spirometry, but they don't put it as the #1 defining factor. As I mentioned before, we look at the symptoms and exacerbations now. So FEV1 and FEV1 to VC ratio can still be used to help with certain severity measures and could be a sign of increase in exacerbation, but it's not the tool that we really direct our treatment at. We look at quality of life and symptoms. For example, can the patient walk at the same level as somebody their age? If they can't, then they're more severely impaired and fall into a category that needs more bronchodilation. If they are hospitalized for their COPD, now they're in a category where exacerbations tend to be more common. They need not just bronchodilators, they need inhaled corticosteroids as well to control the exacerbations. So to your original question, the FEV1 to VC ratio has some of its faults. Some people feel that it overdiagnoses COPD in the elderly and underdiagnoses it in the younger individuals. But I think the spirometry should be used in conjunction with what the patient's presenting to you with. Certain symptoms, certain findings on x-ray, certain physical exam findings. So it's part of the overall tools that a physician uses to say this patient has a degree of COPD that may warrant treatment.